this next project examines whether laterality affects prognostic factors in tumors of the adrenal gland. So these cancers include adrenal cortical carcinomas and pheochromocytomas. There have been previous studies in the past that have found an increased incidence of adrenal cortical carcinomas on the left side and pheochromocytomas on the right side. In other cancers of paired organs, when there are laterality trends, they tend to be skewed towards anatomical differences between in size specifically. So if you look at ovarian, breast, or testicular cancer, when there are trends in laterality, it tends to be because of a larger anatomic size. And then if there are trends in prognostics, it tends to be because of vascular access and things like that. While there are some fundamental differences between the left and right adrenal gland, these differences are more in location, with the left gland being more superior and lateral than the right, and is not reflected in mass as in with other paired organs. Previous works have also suggested a detection bias of left-sided adrenal tumors, for which the difference in position has been suggested as a factor. But we performed this study to determine if there is any effect of laterality on the prognosis and molecular composition of adrenal tumors. Because surgical excision is the only definitive cure for these patients, their prognosis and care plans are directly influenced by anatomical differences like laterality. This was a retrospective cohort study designed using the National Cancer Database from 2004 to 2013, with data including demographics, clinical characteristics, histopathological type, cancer staging, treatment modalities, and outcomes. In total, we analyzed just under 4,000 cases from the NCDB and used similar analyses of patients with adrenal cancer from the Cancer Genome Atlas program in order to validate our findings with molecular and genomic data. A total of 3,962 patients were included in the final analysis, of which 47.2% had right-sided tumors and 52.8% had left-sided tumors. We then performed a subgroup analysis in order to analyze the influence of laterality on prognostic factors. So for our results, statistically significant findings included left-sidedness associated with larger tumor size and distant organ metastases, versus right-sidedness associated with more advanced T-stage and distant lymph node metastasis. That said, there was no difference in outcomes between left and right-sided adrenal tumors. Our work also did find that a greater proportion of left-sided tumors were detected while at a lower stage, which potentially corroborates this previously suggested notion of a detection bias. That said, this propensity towards detection at a lower stage had no impact on patient outcomes. By using the Cancer Genome Atlas program, we were able to find similar clinical pathologic features between the two-sided cohorts. It also determined similar genomic, transcriptomic, and proteomic profiles of the different sided adrenal carcinomas through analysis of RNA sequences, protein expression, and DNA methylation. So in sum, our study found that there were no differences in outcomes between left and right-sided adrenal tumors. This included 30-day mortality, 30-day readmission, post-op length of stay, and overall survival. There were no significant differences in molecular or genomic makeup between left and right-sided tumors. Our findings did potentially corroborate the notion of a left-sided detection bias, but this bias is limited and does not affect tumor staging or outcomes. There was no difference in the cohorts between rates of complete remission, stable disease, or progressive disease, and overall poor pathological grade and distant metastasis were associated with higher mortality risk, irrespective of laterality. Thank you.
Perfect. Thank you, Charlotte. So it seems like in this case, you used the NCDB database for this study. In the past, what was the literature supporting why the left laterality may be more significant clinically?
So some of the past that they'd found was that there was like a German database, a large database of adrenal cortical carcinoma that found like a statistically significant increase in left-sided than right-sided. There were no changes in prognostics, and it has been suggested that this difference in the location of the left-sided adrenal gland makes it easier on visualization and imaging.